Last year, when we were approached as the IT committee to partner on the health tech, one of the things that we looked at how we can really develop and deliver affordable health to the 1.2 billion Indians. Today, if you see what Mr. Sen said regarding last mile connectivity, how do we deliver these science to the poorest of the poor in the remotest part of India? Delivering the theme address, may I request Arnab Basu, Chairperson, IT Committee, Bengal Chamber of Commerce, to kindly deliver this.
Good morning, ladies and gentlemen. It's indeed a pleasure to be here, both as Bengal Chamber and as PwC, to be partnering with the Chamber and with Medica on this prestigious event, which obviously we had a very, very optimistic response last time, and we are hoping that you'll find a lot of value over the next 1.5 days. I think taking cue from what Dr. Roy said, if you look at India's healthcare system now and the healthcare situation, India has too few doctors, very lack of hospital beds, nurses are few, trained nurses are even fewer, and if you look at the overall spending on health as a percentage of GDP, it's far lower than the global standards. Now, one of the things which is very clear that for India to leapfrog on the health front, digital can definitely be a way to enable that. And digital solutions can help in this leapfrogging. Now, the leapfrogging would happen by making doctors more accessible. We heard that India has probably 80% of the healthcare spending going for only 20% of the population. So how do you make the healthcare more accessible? How do you make doctors more accessible? How do you make telemedicine more commonplace? How do you make AI being used more in decision making? And we talked a lot about that last time on how artificial intelligence can really help in improving the quality of decisions, looking at the parameters, looking at past data, looking at other demographics. But when we look at even urban consumers, the consumers want innovation. The consumers want more digital enablement. The consumers are asking for better quality of healthcare, better access. I think they're also asking for greater simplicity. And I think one of the things what we have seen is that as you go for this, when you look at the, hospitals and what the, people are looking from hospitals, they're looking at cost transparency, they're looking at insurance acceptance, they're looking at the speed, the convenience. When you look at, insurance, people are looking for higher coverage, they're looking for a better network of doctors and hospitals. So how can healthcare and these kind of conflicting demands in some cases be met by technology has been what we have been working on and what the industry has been working on. Now, if you look at Indian healthcare, as we again heard from the previous speakers, we think that the Indian healthcare is today on the cusp of a major transformation, whether it is around the adoption of Ayushman Bharat or Shastha Shati, or even the goal of universal healthcare and how we can do it. It is definitely around affordability, around quality, and around availability. Now, when we look at all that, one of the key themes which we talked about last time was how are artificial intelligence and the Internet of medical devices or Internet of medical things, playing a role in all this. And what came out very quickly was that as you are adding more devices, as you are adding more data points or sourcing points for data, we are getting into a situation where there's an overload of data. And hence, to get meaningful health information, whether it is around the generation of that information, or whether it's around the storage, whether it is around standardizing that data, whether it is around the security, and more importantly, around the exchange of such data, what we feel is that blockchain can be the next big step which can help. So it's not just about AI working in its own microcosm, but if you look at these, few specific technologies which are coming in around, large points of data gathering coming from the different Internet of Things, a fair amount of data which needs to be shared and delivered in a seamless manner for AI to work, and then for that to make healthcare more affordable and more accessible. Blockchain can definitely play a part in that. One of the key points which also we found out based on the work which we did last year and again this year was, how do we look at interoperability? And how can we look at providers being better credentialized, better accreditation, and how do we look at the consumers finally benefiting out of that? And there are challenges. There are challenges around patient identification. We don't have a universal system yet, or a platform yet, where you are one patient irrespective of where in India you go to. There's a lot of scattered and disjointed data which is flowing around. You go to each hospital, they have their own way of registering you, their own databases which are not shared. The findings of one hospital is not shared with another, and hence it leads to duplication of data. Data ownership issues have to be resolved. You have to look at the role of third parties in this, and of course you have to look at data privacy. But if you look at blockchain and what it can bring in, we have been working on several blockchain use cases with the government as well, both in the state and at a central level. There are specific benefits which blockchain can bring in, and which we would highlight a bit more in the publications which will come out. There are cases around patient identification, citizen registration, around health profiling, medication tracking, provider care, around health monitoring, health insurance. All of these use cases have some application or the other where blockchain can play a really big part. And if you look at that entire life cycle, right from patient admission to clinical documentation, around investigations, around diagnosis, around treatment, around post-treatment monitoring, around insurance, around payments, we think that India can make giant strides by adopting both blockchain and artificial intelligence. And as we go through the next 1.5 days, we hope that some of these topics are discussed more by the subject matter experts who would be there. I'm no blockchain expert, nor am I an artificial intelligence expert, but again, it's a great privilege for us to be associated with this journey. And as Dr. Roy mentioned, we hope that Eastern India would definitely be considered as one of the key areas where patients would flock in from not only India, but from other parts of Southeast Asia for better healthcare and superior healthcare. Thank you.